morning all. Today we are going to learn about lymphatics of head and neck region. In this session we are dealing with introduction, features, superficial groups, deep groups and deepest groups of lymphatic system and main lymphatic trunk at the root of neck region. Out of total 400 to 450 lymph nodes of the human body, about 60 to 70 nodes are located in the region of head and neck. All the lymph from the head and neck which is drains directly or indirectly into a vertical chain of deep cervical lymph nodes, which surrounds the internal jugular vein or carotid sheath and extends from the base of skull to the root of neck. Most of the lymph reaches the deep cervical nodes after being filtered through the outlying lymph nodes, which are arranged in outer and inner circles. The outer circle forms a pericervical collar at the junction of head and neck, and it is made up of lymph nodes extending from the chain to the occiput. The inner circles that surrounds the upper part of respiratory and alimentary passages and include pretracheal, paratracheal and retropharyngeal nodes. Deep to the inner circle, a submucosal ring of lymphoid tissues known as Walde's ring, which surrounds the commencement of air and food passages. It includes the nasopharyngeal tonsils above and behind, tubal tonsil and palatine tonsil at the side, and lingual tonsil which is present below and in front. Mainly the lymphatics around the head and neck region arranged as three specific groups. They are superficial group, deep group and deepest group. First we are going to learn about the superficial group. They are subdivided into 5 subcategories. They are buccal, mandibular and preauricular nodes, postauricular nodes, occipital nodes, anterior superficial cervical nodes, lateral superficial cervical nodes, like that. The buccal nodes. One member of submandibular nodes lies on the buccinator in relation to the facial vein as buccal nodes. It drains part of the cheek and lower eyelids. Its efferent passes into the upper deep cervical nodes. The parotid nodes. These lies on and within the parotid gland. 1 or 2 lymph nodes rest on the superficial fascia. The superficial group of parotid nodes receives afferents from the upper part of forehead, temporal region, upper part of lateral surface of auricle, anterior wall of external acoustic meatus and from the eyelids. Their efferents drains into upper deep cervical nodes. Preauricular nodes belongs to the superficial groups and lies immediately in front of the tragus. Deep group of parotid nodes receives afferents from the nasopharynx, posterior part of nose and tympanic cavity. Next, the postauricular or retroauricular or mastoid nodes. They are located superficial to the sternocleidomastoid and deep to the auricularis posterior muscle. Their afferents are derived from the upper part of cranial surface of auricle, the joining portion of the scalp and the posterior wall of external acoustic meatus. The efferents drains into the upper deep cervical nodes. Next, the occipital nodes. These are situated at the apex of posterior triangle, superficial to the trapezius and closely related to the occipital artery. They receive afferents from the posterior part of scalp and their efferents passes deep to the posterior border of sternocleidomastoid muscle and drains into supraclavicular nodes. Anterior and lateral superficial cervical nodes. The superficial cervical nodes, they are offshoots of superficial parotid nodes and are situated superficial to the upper part of sternocleidomastoid muscle by the side of external jugular vein. They receive afferents from the floor of external aqueous meatus, lobule of ear, angle of jaw and lower part of parotid region. Their efferents drains into the lower deep cervical nodes. The anterior cervical nodes, they are arranged superficially along the anterior jugular vein. Some member of this group forms suprasternal nodes. They receive afferent from the anterior triangle of the neck below the hyoid bone and drains their efferents into the lower deep cervical nodes. Next, the deep group, which include submendal and submandibular nodes, upper lateral groups, middle lateral groups, lower lateral groups around the internal jugular vein, and lymph node in the posterior triangle. The submendal and submandibular nodes. The submendal nodes, these are 3 or 4 in number, situated on the mylohyoid muscle between the anterior bellies of both digastric muscles. They receive afferents bilaterally from a wedge-shaped block of tissues which includes the tip of tongue, floor of mouth, lingual and labial gums opposite the lower incisor teeth and central part of lower lip. The efferents from the submendal nodes drains into submandibular and jugulo-omohyoid nodes. The submandibular nodes, these are situated in the digastric triangle beneath the deep cervical fascia. In actual contact with the submandibular salivary gland, and some may be embedded in the substance of gland. They are usually 3 in number, one at the anterior end of the submandibular salivary gland, one in front of and other behind the facial artery. One of these nodes lies in the S-shaped bend of facial artery at the lower border of mandible, which is crossed superficially by the mandibular branch of facial nerve, while opening the abscess affecting that nodes, the aforesaid nerve may be inevitably divided. The submandibular nodes receives afferents from an extensive wedge-shaped area which includes the center of forehead, medial angle of eye, the side of nose, cheek, angle at the mouth, all of the upper lip, lateral part of the lower lip, anterior 2/3 of tongue, upper gum through the infraorbital foramen, lower gum through the mental foramen, frontal, maxillary and most of the ethmoidal sinuses. They also receive afferent from submendal lymph nodes. Their efferents drains mainly into the jugulo-omohyoid and partially into the jugulo-digastric nodes. Next, the upper lateral group. This group, otherwise known as jugulo-digastric nodes. They are situated below the posterior belly of digastric in the triangular area bounded by posterior belly of digastric, facial vein and internal jugular vein. The jugulo-digastric group receives afferents primarily from the palatine tonsil and from the posterior one-third of tongue. Its efferents drains into the lower group of deep cervical nodes. The jugulo-digastric nodes act as principal nodes of palatine tonsils. Some members of the upper groups are continuous with the retropharyngeal lymph nodes. Next, the middle lateral groups. They drains thyroid and parathyroid glands. They receives efferents from the prelaryngeal, pretracheal and paratracheal lymph nodes. Next, the lower lateral group. This group is otherwise called as jugulo-omohyoid nodes. This lies on the internal jugular vein just above the intermediate tendon of omohyoid. They receives afferents directly from the tongue and indirectly through the submendal, submandibular and upper deep cervical nodes. The jugulo-omohyoid nodes form the principal lymph nodes of the tongue. Some members of the lower deep cervical nodes extends along the brachial plexus and the subclavian vessels into the supraclavicular triangle. These nodes may be enlarged as ascending infection from the axillary nodes. A few members of these lower groups extends in front of scalenus anterior. The enlargement of these left scalenus nodes is not an uncommon finding in malignant disease of stomach. Next, the lymph nodes in posterior triangle. A few lymph nodes are present in posterior triangle, especially around the spinal root of 11th cranial nerve. Efferents of the deep cervical lymph nodes joins together to form the jugular lymph trunks, one of each side. The left jugular trunk opens into the thoracic duct. The right trunk opens into the right lymphatic duct. The deepest group includes prelaryngeal and pretracheal lymph nodes, the paratracheal nodes, retropharyngeal lymph nodes. The prelaryngeal lymph nodes are situated in front of the conus elasticus, and the pretracheal lymph nodes, which is situated in front of the trachea and above the isthmus of thyroid gland. The paratracheal nodes flanks the trachea and the esophagus along the recurrent laryngeal nerve. The above mentioned nodes are collects lymph from the larynx below the vocal fold, trachea, esophagus and the thyroid gland. Their efferents drains into neighboring deep cervical lymph nodes. The retropharyngeal lymph nodes occupies the retropharyngeal space. They receive afferents from the pharynx, palatine tonsils, palate, posterior part of nasal cavity, auditory tube, tympanic cavity, sphenoidal and the posterior ethmoidal air sinuses. Their efferents drains into upper deep cervical lymph nodes. Next, the main lymph trunks at the root of neck. They are the thoracic duct, jugular trunk, subclavian trunk, bronchomediastinal trunk, and right lymph trunk. The thoracic duct. It is the largest lymph trunk of the body. It begins in the abdomen from the upper end of cisterna chyle, traverses the thorax, and ends on the left side of root of the neck by opening into the angle of junction between the left internal jugular vein and the left subclavian vein. Before its termination, it forms an arch at the level of transverse process of 7th cervical vertebra, rising 3 to 4 centimeter above the clavicle. Next, the right jugular trunk, which drains half of the head and neck, and right subclavian trunk drains into the upper limb, and the bronchomediastinal trunk drains the lungs, half of the mediastinum, and part of anterior wall of the thorax and abdomen. On the right side, the subclavian, jugular, and the bronchomediastinal trunk unite to form the right lymph trunk, which ends in a manner similar to the thoracic duct.